Our service is free, program is free. I'm not going to be contacting you because you signed. It's because we have to report to the feds that we did our free work. So, okay. If this worked right, everybody should have a brochure, a sheet entitled Medicare Pathways, and a form laying out where we're doing our 6 all-day one-on-one counseling events in Southern Lee and Collier. Okay. So, somebody said that you're the ones that have to come because you're unsavvy. Not true. I would say you're the ones smart enough to know this is complicated. It changes every year. You can overpay for things. You can miss out on benefits if you don't pay attention to it. And most people don't. They dread it and they ignore it. So, today I'm going to be talking about the parts of Medicare. A, B, C, D, Medigap plans, and assorted related subjects, okay? Hold. Oh, no, I like to move. Thank you. Thank you. Okay. Just so that I tailor this to your particular needs, got a couple of questions for you. Is there anyone who is not yet on Medicare? Okay, all right. Then I'll briefly talk about how you get on it. Is there anyone who is not a resident of Lee or Collier? Any snowbirds? Oh, this is getting easy. A snowbird? Okay, but you go up for 4, 5, 6 months? To which state? Ooh, long way. Okay. I ask because there are 3 states that are different than everybody else. Massachusetts, Minnesota, and Wisconsin. But we can ignore them this morning. Okay. So, just to, first I have to find the arrows on this one. Little commercial for our program. The federal government requires that every state have a network of volunteer Medicare counselors. It's a free service. We have no connection with any insurance companies. We are not selling anything, unlike many groups who are probably trying to reach you this time of year, especially by phone, mail, TV, radio, billboards. Lots of people out there trying to sell you stuff. Excuse me. All right. In Florida, the feds call our program SHIP, S-H-I-P. Florida calls it SHINE, for Serving Health Insurance Needs of Elders. It's through the Florida Department of Elder Affairs, and they contract with the 11 area agencies that cover the state to do the counseling. So, I'm a volunteer, one of 50 somewhat, with the Area Agency on Aging for Southwest Florida. We serve 7 counties. I'm based in Collier. Okay, I'm based in Collier, but my group of me and 11 others down here provide counseling in Collier and southern Lee County, basically Bonita Springs and Estero. And there are, with some advantage plans, there certainly are some differences between Collier and Lee. Okay. The services we provide, because we're around year-round, so we help people understand original Medicare, and I'll go into them. Thank you. My voice decided to stay home this morning. We help people understand original Medicare, deal with any issues they might have about it. We do the same with Medicare Advantage plans, drug coverage, Medigap plans, also known as Medicare Supplement plans, because unfortunately with Medicare, there are frequently 2 and 3 names for the same thing. We also, for lower income individuals, will screen to see if they're eligible for federal or state help, paying for their Part B premiums and or drug coverage, and we'll help them apply for that coverage. The federal government and the Department of Elder Affairs insist that one of the things we do is help with long-term care planning. The reality is, once you hit our ages, there are only very, very limited things you can do about long-term planning. Long-term care plans are extremely expensive at our ages, if the companies will even write them. Fewer and fewer companies will write long-term care because it's expensive and people are living longer and longer. So a lot of the companies have gotten out of the long-term care business. We also will help people handle Medicare complaints and appeals, and we try to educate on Medicare fraud because it's huge. Every year, 60 billion, with a B, billion dollars of Medicare funds are lost to fraud and various scams. Huge, huge problem. Those that are into the scams and the fraud are merciless in how they prey on very vulnerable people sometimes. Okay. So, for those not on Medicare yet, the way you get on it, you apply through the Social Security Administration. Most often at age 65. Earlier, if someone has been on Social Security disability for 2 years, those folks are eligible for Medicare regardless of age. And this is becoming more and more common because people are working sometimes long past 65. People may delay Medicare if they have or their spouse has employer-related coverage. All right. So, once someone is on Medicare, Medicare comes in parts. First part is Part A, administered by the federal government. You do not pay a premium for Part A. I'll go into more details about it in a minute. Your red, white, and blue Medicare card says Part A is hospital insurance. It is. But it's a little bit more than that because in some circumstances, it also will pay some nursing home and some inpatient rehab costs. Part B. On your Medicare card, it says it's medical insurance. Think of it as outpatient. It would be things like doctor's visits, lab work, kidney dialysis, outpatient rehab, some chemotherapy, hospice services. Sometimes hospice is Part A, sometimes it's Part B. A and B are called original Medicare. They're the services that have been around since 1966, long time. Part C, more commonly known as Advantage plans and heavily advertised, are an alternative to having freestanding Part A and Part B. When people have Advantage plans, the federal government contracts for the plan to provide all the services you would otherwise have under original Medicare A and B, although the Advantage plans can charge different deductibles and copays than original Medicare, and they do. And they normally provide additional benefits. A little basic dental, vision, and or hearing maybe, gym membership. They advertise heavily things like, our Advantage plan covers dental. Original Medicare does not. That's true. They slide over the fact that their dental, which people envision as being implants, root canals, may only cover 2 dental exams and 1 set of x-rays a year. And a big piece of this, Advantage plans almost always cover drugs. For those who have stuck with original Medicare A and B, they will almost certainly pick up a drug plan because A and B only pay for drugs when you're in the hospital or if they're given in a medical setting, like dialysis probably. People with original A and B, also if they do not have a retiree plan, one of the few still remaining because fewer and fewer people have retirement system plans. But if they don't have that and they can afford it, they will usually get something called a Medicare supplement or Medigap, same thing. And that plan will wrap around A and B to help pay deductibles and copays. And to keep it all confusing, there are 10 levels of Medicare supplement coverage. And they're lettered, as if it's not enough to have Part A, Part B, Part C, Part D. With supplements, there's Plan A, Plan F, Plan G, Plan N. It's a muddle. Okay, so let's talk a little bit more about benefits and costs. Part A, as I said, covers inpatient. Part B is pretty much outpatient. Part B has a premium. This year, it's $174.70 a month. Normally, if someone is getting a Social Security benefit, the B premium will be deducted from their benefit before it ever hits their bank. All right? If someone is still working and hasn't started to collect Social Security, they will be billed for Part B. next year, January, the Part B premium is going up to $85 even. Okay. Going back to Part A for a minute, almost nobody pays a Part A premium. People only pay Part A premiums if neither they nor a current or former spouse worked under Social Security. So A is premium free, has deductibles. B has the monthly premium for some preventive services. Part B pays 100% of the cost. Things like mammograms, screening mammograms, when appropriate, bone density tests every 2 years, PSAs, screening colonoscopies, weight and smoking reduction programs, just a slew of them. And by now, anybody who gets a hard copy of this should have received their Medicare and U book for next year. And the book goes into all of the services. This book goes into the services where Medicare B pays 100%. For other Part B services, like a doctor's visit, an X-ray, CT scan, there is an annual deductible, $240 this year, probably going up, definitely going up in January, and probably to about $280, although it hasn't been formally announced. Part B annual deductible, okay? Once someone has paid the Part B annual deductible, B then pays 80% of the cost for all services, and you're responsible for 20% of the cost unless you have additional coverage. And that can certainly be costly if you don't have coverage. All right. The Part A deductible when you go into the hospital these days through December is $1,632. No doubt it will go up. And there are different annual deductibles and copays if you go into a nursing home, rehab, have hospice. They're all different. We're thinking that Part B annual deductible will be $180, $185. We're not sure yet. In election years in particular, the federal government usually does not announce the increases until around Thanksgiving. Part B, that premium, $175 now, $185 come January. About 96% of the people on Medicare pay that base amount. The 4% with higher incomes pay more for Part B coverage. And the threshold is an individual whose modified adjusted gross income is over $103,000 pays more for Part B premiums. How much more depends on their income. It can be double the base, triple the base, or more. Most people obviously do not have income of over $103,000 per individual or $260,000 $6,000 for couples, but it happens. It happens a lot in Southwest Florida. It happens when people do things like they have a place up north, they have a place here. They sell one, not their homestead anymore. They sell that property and probably make quite a bit. Capital gains, it's going to trigger the higher Part B premium. And it's a shock. People aren't thinking of that. Okay. All right. Supplement coverage, also called Medicare coverage. As I said before, and I know you can't read the chart, but it's in that Medicare and U book that you get every year. Plans are lettered, and the different plan levels pay different portions of the Part A and B copays and deductibles, and maybe we'll pay for a little bit more. Years ago, the plan level that was highest, the most complete coverage someone could get, was a Plan J. Federal government stopped authorizing them in 2010. People still have them. Then the most complete coverage became F, Plan F, as in Frank. Complete coverage. If someone had A, B, and a Plan F, could go into a hospital, have a $500,000 bill, and pay nothing. Great. High monthly premium, great coverage. Effective the beginning of 2020, Congress decided the coverage was too great. And now, I'm not going to say I agree with this, but the view in Congress was if someone pays nothing out of pocket, they'll run to the doctor too often. So, effective January 2020, those now turning 65 cannot get Plan F coverage. Next best level of coverage now is a Plan G. G as in George. Covers everything the Plan F covers except for the annual Part B deductible. And you know, that Congress was happier. Everybody has to pay something. Everybody now coming on. Those who have Fs, those who have Js, they're fine, as long as they never give up the policies. Question? Oh, no. Yeah. The federal government dictates what each plan level must cover. So every Plan G provides exactly the same coverage. Nothing more, nothing less. But the companies writing the coverage, and in this part of Florida, about 35 companies write Medicare coverage. The companies set their own premiums. They're all over the place. The difference from a low premium to a high premium can be as much as $100 a month, and the people who are paying all that extra money are not getting anything for it. It's just nothing, despite what a salesperson might say who represents the more expensive company. Well, for those not yet on Medicare, when you turn 65, you have an initial enrollment period of 7 months. 3 months before your birthday month, 3 months after. If you do not go on Medicare till after age 65, you have a 3-month window to enroll in Part A and B. And you have, and this one's kind of silly, if you want to pick up a Medicaid policy, you are guaranteed issuance for the first 6 months after your effective Part B date. Nothing's easy. Okay. Advantage plans. They're the alternative way to get Medicare. When someone goes on an Advantage plan, the federal government gives their Part B premium to the company they've selected. That company also gets a subsidy from the federal government. And the company is then responsible for health and drug care. The federal government backs away. If the company, with the total enrollees, spends less on health care than they receive, they make a profit. If, on average, they pay out more, they lose money. So you can guess, companies gatekeep. With original Medicare and a Medigap plan, you can see any doctor or other provider who accepts Medicare. You don't have to get prior authorization. You just go about your business. With an Advantage plan, they come in various forms. In Florida, all Advantage plans are either HMOs, Health Maintenance Organization. If someone has selected an HMO, the plan will only pay if you go to a medical provider in their network. That's it. Most of the networks are local. Some are statewide. Very few, 1 or 2, you can get services outside your state. HMOs assign, you select, or they assign a primary care doctor. Generally speaking, whenever you need a specialist, referral has to come through your primary care doctor. Most of the Advantage plans in this area are still 0 premium. Although this year, a few of them have started to add small monthly premiums. But whenever you access a service, you may be subject to a deductible or a copay. So if you have original Medicare, you're paying a lot in premiums every month. Will pay almost nothing out of pocket over the year. With an Advantage plan, as you use it, you can be subject to significant deductibles and or copays, especially if, unfortunately, you need something like chemotherapy. Their copays with some of these plans for chemotherapy can be 30, 40, 50%. A lot of money. All right? So HMOs are the most restrictive. The other form of Advantage plan in Florida is the PPO, a preferred physician plan. PPOs have a network. If you use providers in their network, you have one set of copays. You have the option of going outside of the network to any provider willing to take the plan. That does not mean everyone that takes Medicare. If you go outside the network, you will have higher copays in almost every instance. The plans all have maximum out-of-pocket caps for healthcare services. So if you've really had a bad year, 2 surgeries, rehab, and your bills with the deductibles and copays are starting to mount up. When you get to the plan's cap, the plan pays everything on the health, not the drug, everything on the health side for the rest of the year. But the caps will be everywhere from $3,500 for an extremely restrictive HMO to 11 or 12,000 if you have a PPO and go out of network even once. So they can, in the end, have advantage plans financially are a great deal as long as you don't need health care. Yeah. Once you need it, you're going to start paying. And what happens is people at 65, 70 will say, I'm at great health. I'm not going to pay that small drug plan premium every month, plus that high Medicare premium. Forget it. Well, then what happens is they get to 78, 80, and their health maybe, unfortunately, has dramatically changed. Now they do the math, and they'd like to go back to original Medicare with a standalone drug plan and a supplement, and probably can't do it. When you're first eligible for Medicare, you have guaranteed issuance of a supplement. Companies cannot turn you down that first 6 months. After you've been on an advantage plan for a year or more, or for whatever reason just never got any coverage, you're subject to medical underwriting when you want a supplement. If your health's reasonably good, and nobody expects an 84-year-old to be in perfect health, maybe you can get it. But the likelihood is you will be denied the supplement because of your health. There was just an item, might have been Forbes. I just saw one online this morning about the Advantage Plan trap, speaking about this issue of people don't realize when they sign up what the implications might be 10 years down the line. It's a nasty trap. Okay. All right, now we're going to talk about what changes every year, the drug coverage. Drug coverage comes in 2 forms. It might be a benefit within an Advantage plan, or if someone is on original Medicare, they probably have gotten a standalone prescription drug plan. Let's talk about the standalone Part D plans. This year, there are 22 in Florida. January, the number is dropping to 16, including 2 that are under federal sanction, so I don't think anybody would want them. So you're basically down to a choice of 14 drug plans if you have standalone Part D coverage. There are 6 plans going away. 3 of them are from Mutual of Omaha, which never did much business here. So very few people are impacted by Mutual of Omaha pulling out of Florida. But those that are need to get another plan. You don't have to have a drug plan. You can go without one. The problem is, first, 2 months from now, you might be on a drug where you really wish you had the coverage, or 3 years from now, you decide, well, I'm getting older, I better get a drug plan. And you pay a late penalty for every month you have gone without either Medicare drug coverage or a comparable employer's plan. It is a complicated formula based on the average premium nationwide every year. The easy answer is right now, anyone who delays, when they get a Part D plan, assuming they did not have comparable coverage, will pay roughly $4 more in month in premium for every year they delayed. That can be an awful lot of money for every year they delayed. So let's say somebody came on, don't take any drugs, like, not getting a drug plan, and then 5 years later they decide, whoops, now they need a drug plan. 5 years times, it's really a little over $4. That's $20. The premium they pay will include a monthly late enrollment penalty of more than $20 for the rest of your life. Oh, yeah. Yeah, the penalty is, that's the monthly amount. There's an easy way out of this. If someone does not take any drugs, wants to be sure they have coverage in case they go on drugs and they want to avoid the penalty, starting this year and again next year, WellCare has one plan that's zero premium. It's the WellCare Value Script plan, no premium. Last year when they introduced it, it was the first time anywhere in the country there was a zero premium plan. And we all figured they'll give it 1 year and then jack it up. And they haven't. It's still zero premium for 2025. No. Okay, I'm not sure why. That sounds like there may have been a little late penalty in there. Because the next lowest also happens to be WellCare, is $12 this year, going down to $5 something next year. So based on what you need, you can have a cost-effective drug plan, freestanding drug plan, where the premium will be everything from zero to one from Florida Blue Cross, which is way out of line, and it's $167 a month premium. Nobody should have that unless they have an incredibly unique drug situation. I just, earlier this week, worked with a lady who, for 7 years, has been paying for that Blue Cross plan. She's on 4 basic meds. So come January, she will be shifting from $167 a month to zero. Oh yeah, it pays. It's a good program. It has a deductible, annual deductible, but like many of the annual deductibles, it does not apply to Tier 1 cheap generics. It will apply to higher cost generics in the plan's formulary and to brand name drugs. So if someone has a low cost plan, they can be on 6 cheap generics, will never have a copay, will never hit the deductible. At Eliquis, whole different game. You now have the deductible, and the annual deductible max allowed this year is $545, and it goes up to $590 in January. if someone is on some of these big blockbuster drugs, the Eliquis and Trestos, Xarelto, the diabetic ones, Jardiance, Trilogy, they are going to have deductibles. They are going to have copays. Oddly, the zero WellCare plan still works for some of them, but normally they're better off paying a bit more of a premium because the coverage per drug may be a bit bigger, a bit better, okay? Most of the Advantage plans also have drug coverage. Most of them do not charge a premium for their drug portion of their Advantage plan, but they also, like standalone drug plans, will have maybe a deductible, maybe not, and they will have copays. So everything I'm about to say now applies to standalone Part D drug plans and to Advantage plans. Starting in January, there is a $2,000 limit because of the Inflation Reduction Act on the amount anyone with drug coverage, Advantage or Part D, a $2,000 out-of-pocket limit for covered medications in the plan and for the plan's deductible. The $2,000 limit does not apply to the monthly premium. It does not apply to any drugs not in that particular plan's formulary. Yeah, well, they'll all probably cover Xarelto, but let me think of one where they don't all cover it. Some of the diabetic meds, the injectables. I just did one, going blank on it. But they will cover one manufacturer's version of the drug plan, but not another. The plans do not have to cover every one of the thousands of medications out there. The federal government requires that they cover a certain minimum number of drugs in a category. So let's talk statins. Statins are very common drugs. They're required, I think it's 6. They have to cover 6 statins. There are probably 10 or 12 out there. So they will probably cover simvastatin, pravastatin, or atorvastatin. They might not cover lovastatin. So, and it varies from plan to plan. As I said, nothing's easy. Yes, every year the plans may change their premiums up or down, how they implement a deductible. The maximum will be $590 next year. They can charge a lower deductible. They can charge no deductible. They can have a deductible that only affects tier 2 and higher drugs in their formularies. The only way you can figure it out is by going on the Medicare.gov website, or have us do it for you. Starting last year, for straight insulin, not the fancy stuff, straight basic insulin, the maximum anyone can be charged out of pocket is $35 per month, and the insulin is not subject to the annual deductible if there is one. Coming this year, 2025 year, there's a new wrinkle, a payment plan. And this came out because with the Inflation Reduction Act and this $2,000 out-of-pocket cap for drug copays and deductibles, the plans, the insurance carriers are going to take a hit because it's a minority of people on Medicare, but there are people on expensive drugs who normally have out-of-pocket expenses way more through this year than $2,000. And there was great concern that more of these insurance companies would pull out of the Part D and Advantage Plan drug programs because it was a money loser. So, federal government, just for 2025, no promise beyond that, decided to have a demonstration project that every drug plan in the country could participate in, which is weird. A demonstration project, usually. A small group here, a small group there. The carrot was any drug plan that participated in the demonstration project is getting an extra federal subsidy to cover drug plan costs in 2025, which is artificially probably going to keep the premiums low 2025. No idea what will happen after that. The feds also required most of the, not all, but most of the drug companies to agree to institute a payment plan. This is a plan which most people will think, and it's not accurate, it will work like when you're on a payment plan for, not down here, but with your oil company, a budget plan. Every month you pay a certain amount, and at the end of the year you get money back or you owe the company. That's not what this is. The payment plan that will be open to individuals will spread their out-of-pocket costs over the year. So if in January you don't want to have to pay $590 in a deductible for your expensive mid, you can spread the payment out over the whole year. And you can do that with every one of your drugs. But the amount you pay every month will bounce all over the place because maybe in January you filled one prescription. In February you filled 4. Well, the amount you owe every month is up and down and up and down. And at each month they will divide what you owe for the rest of the year over the remaining months. Meaning, if you have high bills in October, you're going to be smacked in November and December. So it's something to be cautious about. Frankly, if somebody can afford it up front, it's better to pay the out-of-pocket costs as they come through. Okay. This is how you select coverage. You can go on to Medicare.gov. The website's gotten better and better over the years. You can go on to Medicare.gov. You can run drug plan comparison, Advantage plan comparison. You can look at the information on the Medigap carriers that would write for somebody your age, your gender, and your zip code who does or doesn't smoke. So you can get a lot of information. If you're feeling really competent, and mildly competent with the computer, you can run your own comparisons. However, if you would like, we will run them for you. Open enrollment is underway right now for the 2025 Drug and Advantage Plan. We would be more than happy to help anyone during open enrollment, which is October 15th to December 7th. But good idea to do things before Thanksgiving because the procrastinators will be there that last week. We will help, based on your medication, run a comparison of your current plan, if you choose, against 2 others, or just 3 plans. It is really important this year for people who are in the plans that are going away. Not the Mutual of Omaha so much, because they're gone. Aetna has 3 plans this year. Come January, they will have 1 plan. They're terminating their highest premium plan and their lowest premium plan. Anyone with an Aetna SilverScript plan who does not make a different choice and maybe has been on the really low-cost, good SilverScript Smart RX, come January, we'll find that they're on the Medicare SilverScript Choice Plan with, I think the premium's 40-something, 48? A few affected people. It'll be 48-something rather than 12, 13, whatever it is now. All right. If someone is on the really expensive Aetna SilverScript plan, preferred, they'll also be moved to choice, lower premium, but they were probably on that higher cost plan because they had significant drug needs that may not be met well on the remaining plan. The other company dropping a plan is AARP United Healthcare. They have 3 plans. They are dropping their lowest premium plan. And those on it, come January, will be moved to the more expensive of their 2 remaining plans. Very expensive. So anybody with I have to look the name, I forget what it is, but the low-cost, Walgreens, the low-cost AARP Walgreens plan, anybody on that needs to review and decide what's in their best interest for next year, and it probably is not being auto-enrolled in AARP's expensive plan. Okay? AARP has 3 this year. They're going to 2. No, they're going to 2. Aetna SilverScript has 3. They're going to 1. Yeah. This kind of thing happens to some degree every year, but this year, because of all that's happening with the $2,000 out-of-pocket cap, the pressure on the companies of their cost for drugs, many, many more changes this year. And people who, it's easy, have let their same plans remain year after year because, oh, geez, who wants to go through all this? Are being hit harder and harder by not looking at their options. Either they're paying way too much for premium and or their drugs are not being well covered. You can. Yes, you can. No. If you're feeling comfortable doing it, you can go on to Medicare.gov. You can create a My Medicare account for yourself, load in all your drugs, have the site compare all 14 of next year's plans for you, and they will list the plans starting with the one that in total will cost you the least out of pocket when you add premium, deductible, copay, whether your drug's fully covered or not covered at all. And it will list them. And as you said, there's an enroll button right there. And if you want to select one of those plans, you just click the enroll button. You provide the information for the new insurance plan. You do not have to contact your current plan. Enrolling in a new one will automatically disenroll you from your current plan effective January 1. Oh, yeah. They're all on there, but Medicare.gov has had a couple of breakdowns this year because of all that's changing. So yesterday I tried to go on and do a plan for someone in zip code 34109, and it insisted it didn't exist. Well, a lot of people will be surprised. They think that's where they live. And it wouldn't take, I think it was simvastatin, kept saying it's not a drug. Well, come on. But it's been fixed again. No, has nothing to do, completely different things. Supplements, very good question, because many people, when they first come on Medicare in particular, think they need to get the plans from the same company. You do not. More than happy to look at it again for you. Yeah. All right. You came in and talked to somebody in person? Yeah, because COVID, we could no longer do in person, and we haven't gone back to it. First of all, we lost some of the sites where we had donated space, and people with COVID just became very accustomed to doing things by phone and email. And last year we did, I gave you a handout, we have done the in-person all-day one-on-one counseling, and then have just learned how to do things other ways. But we're cutting back to 6, but we are doing 6 all-day counseling events. First come, first served basis. You can come in, one of us will sit there with you, and we ask that you bring in your insurance card and your drug list or the actual containers, and we will run the comparisons with you. Yes. The question is, can you jump around from one drug plan to another without problems? Yes, you can do it every year during open enrollment. Guaranteed coverage as long as you do not drop a plan and go without coverage for 63 days. But no problem. People switch often because financially it can be a big difference. Okay. Oh, yes. All right, the scenario. Someone gets the WellCare value script, zero premium plan, was eligible for but did not have drug coverage for 10 years. employers. They are going to have a monthly late enrollment fee added to the premium of $40 to maybe $46 per month. Oh, yeah. Yeah, it's high. Well, the reason, it's insurance. If there was no penalty, everybody would wait until they need, like, why carry fire insurance until your house is on fire? You know, the insurance principle is some people will use the coverage a lot, others will not. But you can't just wait until you have the need, unless you're working and you have coverage there. And with Advantage plans, I should have said one more thing about them. Everything I said about the coverage limitations applies to individually obtained Advantage plans. About 50% of people in the country are now on Advantage plans, grows every year. Although down here it's probably more like 30. In addition to those who have to get their own coverage, employers have been moving their retirement system to Advantage plans. Completely different breed of cat. When a state government or a utility, a teachers group, post office starting January, has a group Advantage plan, the benefits are usually really good. They're available nationwide. They have very few restrictions on their use. The negatives that you hear are about the individually purchased plans. Or they're not your own pay. The individually obtained plans. For Advantage. Yeah. For years, the government was really encouraging people to get into Advantage plans, thinking private industry can do this better than the government and the cost will be lower, and that has not been what happened. The government is being more neutral now, and in fact some in Congress are really concerned about the issues that have been around for a long time with the Advantage plan. Only if you were looking at Advantage PPO plans. HMOs, there's one cap, period. With the PPOs, because maybe you use in-network providers, maybe you go out of network, the caps are much higher if you go out of network. So that's what that's about. And it's individual. Everything with Medicare and Medicare plans, it's individual. There's no group. Yeah, a couple is two individuals with these plans. Well, and that's why. And people get Advantage plans for a whole bunch of reasons. Financial, because salesman, because their buddy has one and said it's good. And it might work well for them. There are risks involved. People are more or less open to risk. But, yep. Years ago, I did a presentation, and two fellows in their late 80s were in the room. One had an Advantage plan, one had a Medigap, and each one essentially said the other one was crazy to have the coverage he had guy in the Advantage plan had been healthy as a horse. To date, working perfectly for him. The fellow with the Medicare plan had a horrible health history. He was forever using services. It was a best deal for him. Individual. Yeah, you can go back to original Medicare. You can get a drug plan, no problem. You may or may not get the Medicare plan. If you're reasonably healthy, yes. Oh, yeah, and they apply medical underwriting. And frequently we'll see it, a couple has Advantage plans. One is starting to have serious health problems, so the other isn't. They want to go back. Companies are happy to write the coverage for the healthy spouse. They will not write it for the spouse who really needs the coverage. So, yeah. Many won't. Yeah, many won't. It's changing, not for the good. Just locally with the Advantage plans, Lee Health hospitals accept all Blue Cross Advantage plans. Right? Lee County Physicians Group, affiliated with the hospital system, will not accept Blue Cross PPO plans. Millennium Health Group, which is huge on the west coast of Florida, will not accept Blue Cross PPO plans. NCH and Blue Cross just went through a very contentious recontracting process where NCH said they were pulling out of Blue Cross PPO. They resolved it. Good for another 3 years. Several years ago, Lee Health got into it with United Healthcare. And that one actually, it went through a stretch of a few months where United Healthcare PPOs could not be used in Lee Health hospitals. And this is happening more and more all over the country with different healthcare systems and different insurance providers. And it's because of reimbursement rates. So. Yes. 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 Yeah. So, anyway, one last pitch. If you would like our help, you can call the number up there. They're really backed up this time of the year, so if you call the number, they will offer you option 3. Take it. It will get you directly to the paid Shine staff in Fort Myers rather than through the formal referral process. You can come to our events. Be more than happy to help you then. If I've worked with you, or any of us have worked with you in the past, and you have our phone numbers or emails, go right ahead and contact us. And if you're computer savvy, you can do